Hello, my name is Sean Sato, and I'm a pediatric radiologist at the University of Iowa, and I'm going to be talking you through a little bit about the care arthritis CHROMRIS case review and scoring system that has been developed, and I hope you will follow along with me to kind of see how this software works. So first we're going to get to the care arthritis page, and I'm going to go to case 7. And to kind of get a general idea of what we're talking about, we kind of have divided the body up into several regions. Each region includes specific bones and segments that we've kind of divided up below. For each lesion, we try and kind of give 3 major components for scoring. These general components are signal size, and that's usually between absent, less than 25%, 25 to 50%, and greater than 50%. Absence or presence of soft tissue or periosteal hyperintensity, and presence or absence of bony expansion. Just some of the areas that we're going to be talking about. The skull is divided up into left and right, maxilla left and right, mandible left and right. We have ribs that we'll be able to click on, and the thing to remember about the ribs is if you're going to click on it for scoring, please click on the rib closest, the medial aspect of the ribs closest to the spine. We treat the sternum as a single lesion, the sacrum as a single lesion, and then we divide up the long bones into 3 different segments, kind of the proximal epiphyseal metaphyseal region, the middle diaphyseal region, and the distal metaepiphyseal region. The hands are divided up into carpals, metacarpals, and phalanges. Feet are divided up into hindfoot, midfoot, and forefoot. And the spine is scored individually by vertebral body level. Patellas we score separately, and for the SI joint, we use the Spark SI joint scoring system, where the sacroiliac joint is divided up into 4 quadrants: upper sacral, upper iliac, lower sacral. And if there's one area of involvement, we give that a score of 1. If there's 2 out of 4 sections involved, we give that a score of 2. And if there's 3 or 4 sections involved, we give that a score of 3. So you can get a max score of 3 on each side. So some kind of specific areas that you might come across. We define a bone unit as a single clickable scoring region within a long bone or a complex bone in this portal. If a lesion crosses multiple bone units, we ask you to score that lesion within the bone unit where the majority of the lesion is located. For example, if you have a lesion that's located within the middle diaphyseal portion of the femur, but it kind of extends distally as well, that should be scored as kind of the middle diaphyseal region predominantly, because that's where it's predominantly located. If there are multiple lesions within a bone, consider the overall additive size of the signal abnormality when scoring the signal size. So if there's 2 discrete lesions in the sacrum, and it's kind of less than 25% of the sacrum, consider adding those sections up. So let's kind of take a look at this in practice, and we can kind of get an idea of what we're talking about. So we have our viewer here, which is fantastic, and it loads relatively quickly, as you can see here. We can see our whole body MRI here. This is kind of a composite image, and I always like to kind of look at this first, kind of see what I'm getting myself into, but then we have kind of additional obliquities and planes to kind of further evaluate. So if we take here and take a look at kind of the coronal chest area, I obviously want to take a look closely at the clavicles, which in this case I'm not seeing much disease in. You can kind of just go up here and kind of click the different series and drag them down. So as I'm taking a look kind of in the kind of mid-abdominal coronal section, I can see that there's increased signal in the distal radiuses bilaterally. So I'm going to come over here and I'm going to click on arms. And so I kind of take a look at this, and I get to the point where I'm talking about radial distal third. So let's click here. And I think that this takes up more than 50% of this area, so I'm going to give it a 3. I do not see any soft tissue abnormality or bony hyperexpansion. So I'm going to give, I'm not going to click on either of those. And then let's go on the other side and let's take a look at that left side again. I'm going to give that a 3 for being more than 50% of the meta-epiphyseal region. Again, I don't see any soft tissue involvement or bone expansion, so we're going to kind of leave that there. Again, if you forget what these abbreviations are, the answers for that is right here. We also have help with the viewer, which kind of lets you know what all the icons mean. This is a pretty robust viewer that you can window and level. You can change layouts. And then also for the scoring help, you can kind of, we've incorporated that right in here, so you can kind of get this information here as well. And so to get back to the scoring, so we've done the distal radiuses so far. Let's see where else we're seeing disease. I'm not going to show you everything to go through, but let's take a look at this. So we have these femurs, and in the femur it looks like there is involvement of the diaphyseal portions of the femurs bilaterally. And so let's take a look on this right side. We have this small area of involvement there. I think that's less than 25%. Again, I don't see any soft tissue or bony expansion, so I'm going to leave that alone. And on the left side, it looks like it's a little bit more on that left side, so I'm going to say that that's, I don't know, somewhere between 25 and 50% involvement. I don't know if that's generous. It's probably still actually less than 25, so let's give that a 1. Again, no soft tissue or bony expansion. And let's take a look at the distal femurs. It's kind of hard to see because it's kind of getting close to the edge of this. So let's take the next view down and see. Let's see. There's a tiny bit right there. Maybe some involvement right there. So for the distal femur, I'll probably give that a 1. Again, no soft tissue, no bony expansion. Give that a 1 as well. Now it looks like we're getting more disease kind of in that proximal tibia. So let's take a look at that. So on the right side, I'll probably say 25 to 50%. And I'm giving this, while there is some of this that seems to extend into the diaphysis, we're going to predominantly put that in the epiphysis metaphysis because that's where the lesion predominantly is. So 2 there, and let's take a look at that other side. And that other side looks a little bit more involved. I'd probably say that that's greater than 50% involved on that left side. So again, I'll give it a 3. I don't see any bony involvement or any bony expansion or any soft tissue involvement. So let's take a look as we keep kind of working our way down that lower extremity. It looks like there's definitely some more involvement once we get into the mid tibia. And so on that right side, there are some small areas of involvement, but they're kind of on the smaller side, so less than 25%, so I'm going to give that a 1. And on the left side, it's a little bit more involved, but let's give that a 2 for 25 to 50% involved. Again, no soft tissue, no bone expansion in these areas. Let's take a look at the distal tibias. Distal tibias seem to be pretty involved bilaterally. So I think greater than 50%, so I'm going to give that a 3. I'm going to give it a 3 on the left as well. It looks like there's some involvement of the distal fibula on both of these patients, but on these patients I know we have ankle views, and so I can kind of see that distal fibula a little bit better on these, so maybe we can evaluate those distal fibulas on these as well, just to kind of get a little better view. So it looks like there's definitely some involvement. This is in the right side. On the left, again, yeah, there's some pretty decent involvement there. So I'd say greater than 50% of the distal portion. on that fibula. Again, greater than 50% on this side. Let's see if we see any soft tissue. I'm not really seeing much soft tissue involvement or bony expansion. Okay, so that kind of covers the legs. It seems like there's a lot of disease in the legs. Let's take a look at the feet. And in the feet, we can see on this right side, it looks like we're kind of getting some patchy edema in the hindfoot and midfoot. I think the hindfoot and midfoot in these pediatric patients can be kind of difficult, and I'm always a little bit, I kind of undercall the hindfoot and midfoot in these patients because it seems like a lot of kids this age just normally have some physiologic high stir signal in these areas. So unless I see something that's pretty bright and pretty confluent, I'm probably not going to call it. So in this right foot, I'm probably going to let that go. In the left side, you see how there's a little bit more higher confluent signal in that kind of hind foot. And so I'm probably going to say that that is involved. And so on that left side, oh, this doesn't help when I've got these flipped around. I apologize. Let's put left to left. Okay. So on that left side, I'm going to go to the hind foot, and I'm going to say, I'm going to call that greater than 50%. And then let's see if there's any soft tissue. And I'm really not seeing any bony expansion or soft tissue, so I'm going to leave that alone there. So let's take a look at what else. I don't think I saw any spinal disease when I took a quick look at this before, but we can kind of take a quick look here. It's kind of motiony, but I think I would let that probably go. Let's see, do we have any disease in the pelvis? Pelvis looks all right. So I've kind of run through this a little bit quickly, but after we've scored these areas, we can submit it, and then we can get this kind of map which shows our areas of involvement and CHROMRIS activity index, which we can see here. And we get kind of a score here, and then we get this kind of graphical representation, which is kind of nice, showing our areas of involvement in this patient. I hope this is helpful, and thank you very much. And if you have further questions, please let us know.